Premenstrual syndrome, commonly known as PMS, has the potential to significantly impact the lives of sufferers. Unfortunately, the condition is frequently misunderstood and poorly managed. PMS will affect most women at some point in their lives, each to varying degrees. A small number may experience some severe symptoms. At its worst, the condition is called premenstrual dysphoric disorder, or PMDD. If you want to learn more, keep watching as we will break down PMS and PMDD in this video. So, let's talk mental health. I'm Dr. Jim Burkus, and in this series, we aim to break down the social barriers of mental health. At JHP Medical, we make weekly videos designed to increase awareness and help you better understand your medical condition. So if you find this video helpful, subscribe, click the notification bell and the like button to support us in helping you. Okay, so what is PMS? Premenstrual syndrome, or PMS, is the name given to a group of symptoms some women experience in the weeks before their period. Commonly, women experience cyclical, distressing, physical or behavioral symptoms which resolve with the onset of the period. Most ladies will experience PMS at some point in their lives, and symptoms may cause detrimental effect on everyday's life. Why PMS occurs is not fully understood. However, a link exists with the natural hormonal changes that occur during your menstrual cycle. How sensitive a woman's body is to the cyclical hormonal changes may also play a role, with ovulation being the triggering event. The degree to which ladies are affected varies vastly. Many experience little to no symptoms, with no perceived impact on personal, social, or professional life. However, 1 in 5 ladies experience clinically significant PMS symptoms, which would benefit from intervention. A much smaller number, around 1 in 20, would suffer severe symptoms, which at its worst is considered as premenstrual dysphoric disorder, or PMDD. So, what symptoms do you get with PMS? The symptoms of PMS vary vastly between women. However, the more common symptoms are mood changes, mood swings. Some women may feel upset or more irritable or even more aggressive. Increased level of anxiety and reduced self-confidence, poor concentration, clumsiness, reduced sex drive, tiredness and insomnia. So the physical symptoms they may experience are headache, breast tenderness, reduced appetite or even food cravings, nausea and vomiting. Some will experience bloating, abdominal pain, constipation or even diarrhea, acne and greasy skin. How can PMS be diagnosed? Most ladies self-diagnose PMS before presenting to the medical professionals. To assist with your diagnosis, we would recommend keeping a symptom diary linked with the dates of your menstrual cycle. This record facilitates your regular doctor's assessment. If you're looking for a symptom diary to help you accurately record your symptoms plus the link to your menstrual cycle, I will include a link to the one we would recommend in the description below. The diagnosis of the more severe premenstrual dysphoric disorder, or PMDD, is somewhat more complex. Whilst the symptoms are like those discussed for PMS, they are typically more intense. To meet the criteria for PMDD, patients must meet strict criteria as per the DSM-5 criteria. Symptoms of PMDD must present in the final week before your period starts and improve within a few days after the start of your period. 1 or more of the following symptoms must be present for at least 2 menstrual cycles. Marked affective lability, example mood swings, so feeling suddenly sad or tearful, or increased sensitivity to rejection. Marked irritability or anger or increased in interpersonal conflicts. Marked depressed mood, feelings of hopelessness or self-deprecating thoughts. Marked anxiety, tension and or feeling of being keyed up or on edge. plus any of the following to reach a total of 5 symptoms. Decreased interest in usual activities, example work, school, friends or hobbies. Subjective difficulty in concentration. Lethargy, easy fatigability or marked lack of energy. Marked change in appetite, overeating or specific food cravings. Hypersomnia or insomnia. A sense of being overwhelmed or out of control. Physical symptoms such as breast tenderness or swelling, joint or muscle pain, a sensation of bloating or weight gain. In addition, symptoms must be associated with significant distress or interference with work, school, usual social activities or relationships. They should also be present for most of the menstrual cycle in the previous year. How can I manage my PMS at home? There are several self-help techniques that may improve your symptoms of PMS. As with all lifestyle changes, they require dedication and are guided by you. They may or may not work for you, but there's no harm in giving them a try. First, let's look at dietary changes. You may experience an improvement in your PMS symptoms through small dietary changes. It's recommended to take regular, frequent, 2 to 3 hourly, small balanced meal rich in complex carbohydrates. You should aim to reduce your sugar, fat and salt intake and increase the amount of healthy fruit and vegetables you eat. It is also advisable to limit your nicotine, alcohol and caffeine intake. Some dietary supplements can also be trialed, however evidence is limited. Many ladies have tried evening primrose oil for their PMS. However, research suggests that this supplement is only beneficial for breast tenderness. Calcium and magnesium supplements have also demonstrated improvement in PMS symptoms. Magnesium supplements appear to have a positive effect in improving PMS anxiety. Vitamin B6 supplements may improve low mood associated with your PMS, and vitamin E may also provide some benefit. So, exercise and wellness. Taking regular exercise is known to be beneficial in improving PMS symptoms. Having a good method of stress relief is also very important, such as regular meditation or yoga. Having regular good quality sleep is also very important. If you're struggling to get a grasp of your PMS symptoms, seeking advice from your doctor is very important. Where your main symptoms are pain, your doctor will likely recommend a trial of non-steroidal anti-inflammatories such as regular ibuprofen. Hormonal treatments are also useful. These are usually centered around new generation of the oral contraceptives. These aim to suppress ovulation, therefore suppressing the hormonal cycle. There is good support for the use of the combined pill called Yasmin. Ladies can also take this medication continuously without a break. If your symptoms are more severe or the combined contraceptives are not appropriate for you, your doctor may consider an alternative non-hormonal treatment. In most cases, you would be offered an SSRI, which is a selective serotonin reuptake inhibitor. These medications are used also to effectively manage depression, so are commonly known as antidepressants. Whilst you take this medication continuously, an alternative is also to take them during the luteal phase of your cycle, which is day 15 to day 28. However, it is important to stop taking this medication if you're trying to get pregnant, as although unproven, they may have an association with birth defects. You may also gain benefit from psychotherapy. This usually takes the form of cognitive behavioral therapy, also known as CBT, and is routinely offered by your GP or the primary care physician. Therapy is important to help address the very important psychological element of your PMS. CBT alone has shown to provide a significant improvement in psychological distress and social interference caused by PMS. Here, you will work closely with your therapist to help regain control of your psychological symptoms by changing the way you think and feel about your PMS. If, despite a trial of SSRI, the combined oral contraceptive pill and/or psychotherapy, your symptoms of PMS remain troublesome, it's likely your doctor will organize a referral to a specialist. Your specialist can try other hormonal medications such as danazol. Danazol is useful in improving PMS symptoms and breast tenderness. Estrogen therapy. This can be trialed as a patch or the implant. GnRH analogues. GnRH analogues blocks your hormones centrally within your brain, suppressing the PMS symptoms. This treatment is usually limited to a 6-month period as there is a risk of weakening your bones. This may be used as a trial for ladies with severe symptoms who have completed their family. And finally, surgical oophorectomy, which is the removal of the ovaries and therefore the ovarian trigger for your PMS, and should only be used in ladies with severe PMS. So let's talk about the prognosis. The symptoms of your PMS are likely to fluctuate throughout your life. For those who require medical support for their symptoms of PMS or PMDD, the vast majority experience a significant improvement in their symptoms. Remember, you're not alone. All of us ladies will experience PMS at some point in our lives, some more than others. I hope you have enjoyed this video. Don't forget to subscribe and interact by giving us a thumbs up or leaving a comment below. By doing this, you will help support the growth of our channel and our mission to help educate as many people about a medical condition as possible and hopefully improve their quality of life. Of course, this video does not provide individual medical advice and is intended for informational purposes only. Do not consider this as a substitute for professional medical advice, diagnosis, or treatment. Please do not ignore professional medical advice in seeking treatment because of something you have heard here. If you believe you may have a medical emergency, immediately call your doctor or ambulance service. Thank you for watching. See you next time.